Now quickly trying to move to the next stuff which we are discussing here, and this is the pathophysiology of mitral stenosis. Pathophysiology of mitral stenosis. Okay. So for the mitral stenosis is just all about this mitral valve here is becoming narrowed up. So as it's becoming narrowed up, we're now just trying to look at the step by step. How does it actually come to become like this? So the narrowing is mostly due to rheumatic fever leading to obstruction of blood flow from the right atrium to the left ventricle. Do you understand? Left atrium to the left ventricle. So blood flow from here down is the one that will be affected. Do you understand? So this results in elevated left atrial pressure, pulmonary congestion. Eventually there's a right-sided heart failure. Okay. So pathophysiology, first of all, it comes in because there's damage to the valves. Okay. So rheumatic fever is what leads to the inflammation, then damage to the mitral valve. Okay. So you have fusion of the valve commissures. You have thickening and calcification of the valve leaflets. There's shortening and fibrosis of the chordae tendineae. Okay. So the whole changes reduce the mitral valve area. Okay. Typically from a normal 4 to 6 centimeters square to 1.5. Alright. So there's impaired blood flow. So the narrowed valve restricts blood flow from the left atrium to the left ventricle. Alright. So this creates a pressure, okay, across the mitral valve to now increase left atrial pressure. So elevated left atrial pressure is what leads to the pulmonary venous congestion. Alright. So over time it leads to accumulation of blood in the lungs, right? As pulmonary hypertension, right ventricular hypertrophy, because the right side is working too much to compensate for the failure of the left side. They eventually also have the right side failing. So the left atrium enlarged due to pressure overload. This predisposes it to atrial fibrillation. So reduced left ventricular filling leads to what? Decreased cardiac output, causing fatigue and exercise intolerance. So in advanced cases, patient might be vomiting blood, having difficulties in breathing when they sleep, and accumulation of fluid in the extremities.